the Asp-PSC study stands for aspirin in primary sclerosing cholangitis. The purpose of this study is the idea that prevention is better than cure. And this study is funded by Cancer Research UK. We're starting recruitment in the first half of 2024. And for this study, we need 968 patients who've got primary sclerosing cholangitis and inflammatory bowel disease. And the idea is to see whether aspirin can reduce the risk of complications such as cancer in patients with PSC and IBD. So why aspirin? There were various studies, historic studies looking at historic patient data, which suggested that if people had been taking aspirin, they might have a slightly lower risk of some cancers. But that was never proven. It was what we call cohort studies or historic data, and there were lots of possible other factors that could have played a role. The science behind aspirin has advanced, and we now know that aspirin may have a role in interrupting several biological pathways that in theory can cause cancer. And based on this relatively new scientific data and some of the historic literature data, we thought that what we need to do to find out whether or not indeed aspirin is safe and can reduce cancer in patients with PSC and IBD, we need to do a randomized control trial.